So this past year, I received a KL2 award, which is an Institutional Career Development Award from the NIH. And my proposal for the KL2 is to utilize artificial intelligence to see if we can predict neurogenic bladder treatment outcomes, specifically in patients with multiple sclerosis. As we all know, patients with multiple sclerosis have neurogenic bladder. Up to 90% of them will experience some sort of urinary dysfunction throughout their care. And it also happens to be something that's very undertreated because a lot of MS patients prioritize their MS treatment, maybe their mobility, even though they're living with debilitating urinary incontinence. And in my own clinic, in the female urology clinic, I see lots of patients with this condition, and it really inspired me to think about how can we better predict what treatment to give these patients, because not all patients are the same. MS patients are not the same as a non-MS patient, and we shouldn't be applying the same overactive bladder treatment outcomes to these patients. So what we are using is using a lot of artificial intelligence techniques. We're using supervised learning and machine learning models to see if we can find a predictive pattern to treatment outcomes. The next phase of this is incorporating MRI imaging to see if the specific MS lesions could correspond with their neurogenic bladder symptoms, and ultimately if that corresponds with their MS treatment or their neurogenic treatment outcomes. This is a 3-year project for me because it's a 3-year career development award, and throughout this process I'm also enriching my own education and understanding of artificial intelligence and machine learning through UCI by taking classes with that. And I'm also collaborating with an artificial intelligence expert that we have here at UCI, which is Dr. Olivia Chang. I'm also collaborating with the MS Institute that we have at UCI, which includes Dr. Dimitriou, Dr. Sai, and Dr. Tai. So it's truly a multidisciplinary collaborative effort. And my hope is that from the KL2 data that I'll generate, hopefully in the next 6 to 12 months, we can apply for our R01 to push this one step further so that we can benefit other people with brain tumors, other people with strokes, and other people with other neurological disorders with bladder symptoms.